I am HO Talk Show. We're still here. Sir Charles.
Max.
Razor.
Hey, Ron.
And thank you all for staying tuned. The IMHO Cville tomorrow virtual town hall special about the COVID-19 response here in our area. Doing what we do, taking Cville to the world and bringing the world to Cville. So remember, comment online, IMHO Talk Show, or here at the station. Lines are open, 434-422-9101. And without further ado, we are just elated to be joined by a couple of reps of our area. Glad that they were able to take the time and talk to us. And more importantly, talk to you, family. Talk to the citizens firsthand. We have none other than Police Chief RaShall Brackney, Fire Chief Andrew Baxter. Thank you both for joining us. And first of all, I guess Chief Brackney, ladies first. First, how are you doing? How are you holding up during all this?
So, we're doing well. These are extremely stressful times, but as we know, we're always prepared for times just like this. That we're holding in there. We know that this community is committed to doing and getting this right so that we can protect those of us among the community who can't protect themselves. So we have that social responsibility to make sure that we do that, and our people are really holding up well underneath extraordinary stressors. As we are not permitted to socially isolate, we can't socially distance,
right.
And we cannot come out of the community at a time when the community desperately needs us. So with the everyday stressing of police work, add on that additional layer of uncertainty around the COVID-19 virus and the possibilities of exposures and taking those home to your families and things of that nature. So we're hanging in there. And as we say, we come in to work every day so you can stay at home.
Nice. And, before we dig deeper, definitely want to give Chief Baxter the floor as well to formally introduce himself because, RaShall knows she's family. She's been on here a couple times. But we got a new member joining us here, the Fire Chief, Andrew Baxter. Thank you for joining us, sir. And just real quick, sort of bring us up to date as well with you and your team.
Sure.
So give a formal introduction of yourself.
Sure. Well, thank you so much, Charles, and all your folks for inviting me. Hopefully, this will be the first of many opportunities to connect with our community through your platform. Appreciate it.
Sure.
We've had a lot of folks in the community have reached out to us for information, and it's just so important to take every opportunity. We just don't want to miss anybody with these really important messages. So. We're doing okay. As Chief B said, this is what we do. We are the folks that spend all of our lives, really professionally and otherwise, focusing on things that most people don't think about. And that's our job. And every once in a while, something happens, in this case, a once in a century type event, a global pandemic where we say to the community, hey, you really need to listen to us right now. We have your interests at heart. And that's really what we're trying to do. So, our firefighters are doing well. They're well equipped, well trained, and I'd like to think well led. And as Chief B indicated, we don't really have an option to stay inside.
That's right.
It's what we do. Our folks are ready to take risks. It's what they signed up to do.
That's right.
They don't see themselves as heroes, but they certainly do heroic work every day in the community. And we're really grateful for the support that we've gotten, that we always get, but then also, in particular, in the last month.
So, so team is kind of open up to the floor, as well as you listeners, 434-422-9101.
I have a question. How y'all doing today, first off?
Doing well.
We're good.
All right, now, the first question would be, as he calls you, Chief B.
I like that.
I like that, Chief B. When dealing with officers nowadays, they can get sick just like we can. So there's no confusion. Let's say, for instance, I'm speeding down the highway. Officer pulls me over.
Which you would never do.
Which I would most certainly do if I got to get somewhere. Let's not tell no lies just because we got COVID around here. All right.
Hypothetically.
There you go. Help him out.
For a friend.
Hypothetically, if the situation come up, Razor gonna speak. But I'm just playing. But let's say an officer does pull me over. How should I react in that situation Like, because I'm supposed to put my window down, pass my information, go back and forth so the situation goes very smoothly. But because I'm supposed to practice social distancing with everyone else, what should I do with the police at that point?
So that's an excellent question, especially since this is now contrary to everything we've always said about when you engage with a police officer, right? That you pay attention, that you hand them your stuff and your information immediately, that you're in close proximity. So currently our approach right now is, so this may be your lucky day. This is not your get out of jail or get out of speeding pass, free pass. But what we are doing is we are practicing social distancing. So we may ask you to hold up your driver's license, right? That we take photos of things like that so that we can take that information back. We're not going to exchange that information back and forth. Our officers will be in personal protective gear when they come up and approach you with their vehicle, and that's when they approach you at your vehicle. And that's because we're trying to protect you as well as ourselves, because we are constantly doing a lot of things, taking temperatures of our officers as they're coming in and out of the stations. They're wearing masks and personal protective equipment. Okay. So we're going to ask you to keep that social distancing. So if we ask you to show us your license, we would hope that you would absolutely just cooperate so that we can do things like take a photo of it and not exchange that information. But more likely than not, unless it's a very serious offense, we're not going to pull you over. You just get that surprise in the mail.
Behave.
And
that's right. That we've seen or we noticed a violation. This is not the time for punitive type of engagements. We are trying to keep each other safe, and the much more important thing is the conversation that we probably will have with you about staying at home. Unless it's essential to be out there, it's the time to educate that this is not the time to be out in the community so that we can continue to keep this community safe.
And Chief Baxter, for you, you're right at the top of the food chain when it comes to how the city is dealing with this COVID-19. Is that correct, sir?
I think that's not a phrase I've used before, but I think that's probably fairly accurate. Yes, sir.
How are you personally dealing with that stress? Because, I mean, it's one thing to be head of your household and have to make decisions that affect your children and your wife. It's another thing to have to carry the weight of a city when death is on the horizon. How do you deal with that on a personal level, sir?
Boy, that's a heavy question, but it's a good question. And I will tell you that that's something that anybody in my role or a similar role, police chief, fire chief, mayor, city manager, board of supervisors member, county executive, president of a university, all of us, I think, are in that position on a regular basis. We're always thinking about the whole community. And if I could, we think about our department as a family and the public safety community as a family. So this is really just an extension of how we normally think about our work and where that fits in. There's not too much of a distinction between personal and professional at this point. I'll share with you and your listeners, my wife's a nurse practitioner at the hospital. Our daughter is an ICU nurse. We are, this is something that impacts every single part of our life. It is just, it's just who we are and what we do.
I had a question for both of you as well. So for you, Chief Brackney, I was just curious if you could explain to the listeners how the virus and, practicing this social distancing affects your day-to-day operations. So for the person that says, I'm calling the police department because of the noise violation, or for the person who's wondering, are you still patrolling the city in terms of riding through the same as you were before this whole pandemic? And maybe if you could speak to that, and then I'll pose my question to Chief Baxter.
So thank you, Max. That's an excellent question. So we are doing things differently than we have before. So patrolling is still part of the narrative, and it's part of what we do. And we need to still be out in the community. It does provide a sense of safety and security that someone is there and that someone will respond in your emergency. So I think it's a reassuring presence in some ways. But we are doing things differently than we've ever done before. We are now taking a lot of complaints over the phone or online, where we would normally have come to a location for, say, a noise complaint or a parking violation or something of that nature. We're now doing those online, or now we have a non-emergency number where you can call and speak to an officer, and we're having to use technology. That means calling that apartment or calling that business owner to say that there's been a report of either noise or some other violation, and that we're going to ask them to comply. If it gets to the point where we have to get to that location, we now are going to use our PA system so that we can do things over the air or the radio that we would have normally come and knock on the door and had that opportunity to engage a person one-on-one. So we are employing technology as we keep people safe around those calls. What we can say is those kind of call volumes have gone down, and people are not calling for those type of calls, although they are calling definitely for the more serious calls, such as violence in the community, domestic violence, the potential of child abuse, robberies, or even burglaries in progress and things like that. Those calls are actually starting to increase.
Gotcha. Hey Max. So definitely hold your thoughts. We're up against a break, and so your question for Baxter. Then I know that I think Giles and Aaron also has something to follow up with. But before we go to break, real quick, we do have a caller coming in. Caller on the line. How are you?
Hello?
Yeah. So you're live on air. IMHO, Chief Baxter and Chief Brackney. Who are we speaking with?
I just was listening to Chief Brackney and Chief Baxter. Just wanted to call in and just tell them thank you.
Tell them who you are.
For everyone to hear. This has been amazing downtown, and the leadership of both of y'all we appreciate, and we wouldn't have been able to do this without y'all. And on behalf of City Council, we appreciate your sacrifice, and I hope you all are having a wonderful Sunday and a happy Easter.
Hey, and so did everybody catch that voice? You know who that is?
That's Mayor Walker.
That is the Honorable Nakaya J. Walker.
Yes, Madam Walker.
Thank you.
I'm looking forward to some of your mac and cheese, Mayor.
Oh, she made mac and cheese.
Shouldn't have told us that.
Yes, sir.
Mac and cheese, that's what we hear.
She gonna give it to you through the door until this COVID-19 over. I can promise you that.
All right, y'all. So yeah, like I said, let's take a quick break. IMHO Talk Show. We are still here, joined by our fire chief Baxter and our police chief Brackney.
You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis, only on 101.3 Jams.
IMHO Talk Show, and we are here for this IMHO Cville Tomorrow Virtual Town Hall Special. 434-422-9101. Man, thank you all so much. Hopefully you get as much from it as we are. But we are here with our folks, and it is Sir Charles.
Raise them.
And everybody else, the birds.
Who got birds?
The birds tweeting. So we this virtual town hall, we are abiding by the code of law right now with the social distancing, but we had to be here for you, for the people. So is everybody on? Can you hear us? Chief Baxter, Chief Brackney, you still with us?
I think y'all should be.
Hey, so Chief Baxter, Chief Brackney, still with us?
Yes.
All right, gotcha. Awesome. So, and where did we leave off at? So I believe Aaron and Max both had something that they wanted to share with us. Let's see, Aaron, Max, one of y'all want to take it next?
Yeah, either or, it doesn't matter.
All right.
I guess I left off, so probably, let me take it now.
Yeah, go ahead.
We live?
Yep. Go ahead. We good? Oh yeah. Sorry about that.
Yeah.
Y'all please excuse us.
Charles had to look. I'm gonna do. Y'all say I was a snitch anyway, so I'm gonna tell it all. Charles had the mic muted and he was just up here talking. Y'all missed all kind of stuff. He didn't took his own shine.
Hey, but the people heard me.
The people heard you. The people heard you. But the guests ain't hear nothing.
Yeah, I promise you, listeners, we've been doing this for a while. I promise you. I had a question. Actually, the chief's response to my last question triggered another. And so that was with the people that are, worried about the social distancing and those that are not practicing it. I'm sure you're bound to be getting a lot of calls with people are hanging out, people are, just in groups and places that they shouldn't be.
Churches.
Almost like looking for police intervention. And so I'm wondering, how much are you enforcing that? And then to Chief Baxter, I wanted people, in this situation also, they want answers, they have questions, they want action, they just want transparency here. So when you, as the lead of the Emergency Operations Center, kick into effect and start to make decisions, meet with people, decide how we're going to handle situations like this, what process goes into all of that? The answers kind of roll out to them, but, everybody has an opinion. Everybody always thinks they can tell you how to do it better. So I'm just wondering if you could shed some light on how that process works behind the scenes.
Sure. So the planning process, you're right. There is a lot that goes on behind the scenes, but we're pretty disciplined in how we approach planning. I should note there's a fire going on right now that was dispatched during the commercial break, and they went through that planning process very rapidly. There, literally in a matter of seconds, and the fire's now out. What we do in a situation like this is really the same process, but in a longer time frame with more people involved. And the first step really is to establish what our priorities are. And in a pandemic or a health emergency, obviously the priority is life safety, is caring for the people in the community, their health and their safety. So as an incident commander, the most important thing that we do, anybody in this role does, is establish our strategic objectives, our strategic goals, and then everything else flows from that. So it's been a month now that we've been engaged in this process. It was actually March the 12th that the emergency declaration was made at the local and state level. So what we established as our objectives, our strategic objectives, were providing essential services as a local government. We have to make sure that we're still doing police response, fire response, emergency medical service response, water, gas, light, all of those things that keep the basic services functioning. We're really focused on identifying and protecting and supporting our vulnerable populations. So obviously our homeless population, people that are housing unstable, other people in the community that are already living on the margins, that if they get sick, is going to put them in a really dire straits. So making sure that we have those systems in place and supporting existing systems and make sure they can absorb the impact of perhaps more people requiring assistance. And then protecting and supporting our first responders, all of our essential workers, right? So we can't do strategy number one effectively unless we make sure that the workforce is safe. And that includes healthcare providers at the hospitals and primary care providers. And then that's related to the fourth strategic goal, which is to protect and sustain the health system. Everyone at this point, I'm sure, has heard the phrase flatten the curve. And the reason that's important is we might not have a smaller number of cases at the end of the day, in 6 months when we look back. But the fact that we can flatten the curve and extend those number of cases out over a longer period of time gives the hospitals and the healthcare system the ability to absorb those additional patients. So that process then leads to specific objectives for each one of the disciplines, each one of the areas of focus. So the police department then has objectives related to those four goals. The fire department does, social services does,
nice.
Human services, all the city departments. The other thing that's really important for the community to understand is that we cannot do this alone. There are tremendous efforts underway in the city, in the county, regionally, statewide, nationally, to fill in the gaps where local government and state government and federal government either don't normally function or, quite honestly, don't normally function well. So had an incredible amount of support from the community. Support Cville.com, Equip Cville, faith-based community, traditional NGOs, Red Cross, others, United Way, groups that you would expect to have a footprint in this type of environment. But it really is an incredible process. I think I can speak for Chief Bree and say we're really proud to be a part of this and just so impressed with how this community has come together.
Excellent. Thank you for that response. All right, family, we're going to take a quick break. You're tuned into In My Humble Opinion. When we come back, more conversation with Chief Baxter and Chief Brackney.
You're listening to In My Humble Opinion with Maxilia Robinson and Charles Lewis. Only on 101.3 Jams.
IMHO Talk Show. Yeah, I have Sir Charles.
Hey, you got Max.
I got Raisin.
Take the leg in.
It ain't delay. It's that shea butter you got on. That's
Your hand keeps slipping off the button.
it just knocked him out. That's all. He got that shea butter on.
Hey, look,
That's one of them homemade remedies. He think gonna stop COVID-19. If I rub shea butter on my body, it'll slide on.
You're working so hard.
Yeah, but for those that
Darth
don't,
Vader called. He wants his mask back.
so for those that don't know, thank you. Tell a friend. We're here on a live, virtual town hall COVID-19 special, for our city's response to this coronavirus. If things sound a little bumbled at times, please excuse us, because we're not used to doing the live broadcast of a virtual town hall. Because normally, I can check everybody's body language, you make eye contact, and I know when you're going to go, when you're coming.
When you're going to drink water, when you're going to bite your sandwich, all that type of stuff.
But we are professionals, and we are doing a pretty good job.
Yes, sir.
So, but better than us, we have the experts here with us. We still have Police Chief RaShall Brackney. We have Fire Chief Andrew Baxter. And joining us right now, too, is clinician of Counseling Alliances of Virginia. Did I get that right, Mr. Gene Cash?
Yes, sir. Counseling Alliance of Virginia. You got it.
That's right. So thank you all for joining us. But before we go any further, I know that we had a rebuttal to some of the conversation that we have been having. So Chief Baxter, and I know you had something big for our African American community. So I want to kick it over to you so you can, pick us back up.
Sure. Thank you, Charles. One of the processes that takes place in the community when someone tests positive or is presumed to have COVID-19 is the health department and all their professional staff go back and do what's called contact tracing. So they go back 14 days and see where that person has been and can identify folks that may be at higher risk and be tracked or quarantined or perhaps hospitalized. That contact tracing process has revealed a couple of areas where we have seen transmission of the disease that I think it's really important to highlight for the community. And those are two things: attendance at religious services and attendance at funerals. And I think all of us understand in our DNA how difficult it is to not come together. I mean, it's Easter Sunday. We're in the middle of Passover.
That's right.
And certainly when someone in a family or loved one in a community, a friend passes away, I mean, that's just human nature to want to come together. But it represents right now a real risk. And so I've heard Dr. Bond speak about this very passionately. Maybe now is the time to wait. You have a small funeral if necessary, and then do a memorial service later on when things are more in control in terms of this virus. And I don't mean to sound morbid on Easter Sunday, certainly, but there's some real consequences.
It's true.
If people don't adhere to those guidelines. So thanks for the opportunity to share that. It's not a fun topic to talk about, but it's critically important.
Yeah. That's that was actually a bomb dropped in the African American community.
We have to take that's very, very serious.
Because when you look at it, a lot of the disparities that go on, church is the only place where you find some sanctity. So when that is saying, okay, you can go where you think you have your sanctity, but it might kill you. Now it's like, you have to watch depression. And Gene, I can only imagine how people will need your services when that comes along.
And for some people, Gene, before you respond, for some people, my healing or my covering, right, from this virus is my faith. So I'll be fine if I go to church. I'll be fine if I gather with my church folk. God will protect me and heal me from whatever.
Covered in the blood of Jesus.
Yeah. We have to be smart too.
Yeah, one of the things that we're seeing is a lot of people still want to connect to the community and get that support. And as Corona continues to push forward in our communities and the quarantines are increasing by day, People are definitely looking for more outlets. Anxiety is another big issue that's picking up. And in the families, with losing a loved one, I've had a couple people funerals. Just how do you mourn? How do you address all the distancing? Excuse me. And also, I think the other thing is that being so close together. So now we're having families with each other more time than not. And I think people are wanting to get out. I know my mother is wants to go to the store every day, and she never went to the store.
Wait a minute, you broke up, Gene. Can you hear me?
Xbox has got
Okay.
There you go. You came back. You kind of
Yeah, get you a PlayStation.
He trailed off. I think he may be back.
I'm sorry.
Yeah,
I'm
there
just
you
saying,
go.
people are just needing to get out and connect, and the more and more the quarantine goes on, it's difficult to help them understand that staying at home is the safest thing. And if you do go out,
keep losing you, Gene. He faded out again. Sorry
Hello,
about
Gene.
that.
Maybe we could defer to Chief Brackney about the questions that I had for her.
Thank you.
So thank you. So the things that Gene are saying about people wanting to be together during this time, although that is a human nature, a human desire to connect, there's a couple of things that we want to talk about. One, church isn't a building, it's the people, right? So there is a way to connect with each other, and we have to be much more intentional about that and how we connect. Unfortunately, though, based on the current executive orders out of Governor Northam's office, E55, Executive Order 55, that built on Executive Order 53, there is mandated social distancing, that you can't gather with 10 or more individuals, that you have to close your businesses in restaurants. You can't have, a sit-down location, that you must have takeout or online ordering delivery service and things of that nature. So we are averaging to the 911 center about 5 to 6 calls a day that are coming in through that line. Through our non-emergency number that we've established through the police department, that's a much higher volume in which individuals are calling to report that incidents are occurring. So again, we're taking the education aspect first, understanding that people are under high stress right now. The first thing we're doing, if it is that type of call in which we can respond through a phone call, we are doing that first, and we're notifying the individuals that there has been a 911 call, that they are in violation of the executive order. And the reason that we want them to comply is so that we can stay healthy, right? That we still can have the ability to sustain this city and the region.
Okay.
The second time, if it's a repeat offender or repeat calls, we are not only notifying 911, we notify the health department and we notify the Commonwealth's Attorney's Office that there has been a violation. So that if there's a person who isn't willing to comply for whatever those reasons they have, right now we have some individuals who believe it's constitutionally, their constitutional protections are being violated by stay-at-home orders, or that you can't freely move about. But with freedom comes responsibility.
That's right.
And we have a responsibility, a social responsibility and an ethical responsibility to do what's best on behalf of each other as a community and as a neighbor, or as for our neighbors.
Yeah.
If there is repeated violations, make no mistake about it, we will issue that misdemeanor, which can lead up to a year in jail and a $2,500 fine, which segues perfectly into Max's question about how do we socially enforce social distancing in the jails, and what have the jails' efforts been? Here in Charlottesville, as a matter of fact, we are leading the effort in reducing the jail population, working in concert with our Commonwealth's attorneys, both the regional one in Albemarle, as well as the one in the city, because we understand that although you may be sentenced to incarceration, you are not sentenced to death. And we have a responsibility to make sure that we look at each and every case and do what is humane, what is just, and what is ethical. And I have been fully supportive of the efforts through the ACLU, as well as a variety of other agencies, to reduce our jail population. And they've been able to do that in the Albemarle County Jail, the regional jail, by 100 or so individuals. So it's a quarter of the population. So that actually now gives us an opportunity to think about what can we do beyond the pandemic. If we can release people at this point in time ethically, is there some thought that should be given to, is incarceration the right way to do things on an everyday basis? And does it take a pandemic for us to start to look at the system differently?
I like that. And so I'm going to kick it over to Aaron. I know he's been patiently waiting with a question or comment.
No, I appreciate all that good information. In Minnesota, I'm not sure if you guys are aware, but an executive order had came down specifically about sharing positive COVID data with first responders for protection. Has that been something that you guys have heard about or possibly instituted? Obviously not being shared with the public, but for either of you, is that something that you could see maybe coming down the pipe or possibly be an option for your local jurisdiction?
Yes, that's already occurred in Virginia. An order, I believe it was Dr. Norm Oliver, the health director for the state, who issued that within the last week to 10 days. We'd already been doing screening on the front end. So somebody calls 911. We had a series of questions that we've been asking for well over a month. Initially, those questions are really targeted at people with particular travel history from countries pandemic that we knew were higher risk. And now they're more general and more refined. I know that sounds contradictory, but and then that information is passed along in a secure way to the responders on our computer-aided dispatch system. The balance, again, and Chief Brackney always speaks about this so well, is between privacy and sort of the social contract. So it's not something that's going to stay in the CAD system forever. It'll drop off at some point because we don't want people to, we don't want to use people's private health information inappropriately. But in this case, in terms of making sure that our responders have every piece of information that they can have to make really good decisions, everyone's aware that we're facing shortfalls in personal protective equipment. So the more information that we have going into an incident, and maybe we can limit the amount of PPE that we have to wear on that incident, it'll save that PPE for another incident where we don't have a choice, where someone's really critically ill or injured and we have to get in there and do our work. So it's a really interesting question.
Gotcha. Now we have a question that gets a little more specific into exactly what you're talking about. Question is, what have the challenges been in situations where people need CPR and other life-saving procedures that require that close contact?
Yeah. So, I said earlier in the broadcast that our folks and police officers, firefighters, paramedics, we sign up and we know we're taking risk and doing CPR and working what we would call a code, a cardiac arrest in the field. Generally is not a terribly high risk procedure for our responders, but now it is because of the the risk of increased aerosolization of the virus. And so we take precautions in terms of make sure we're wearing the right personal protective equipment, and we minimize the number of people that are immediately around the patient, but it's a risk that our folks take every day and they're willing to take. And we just have to make sure that we're equipping them and training them and leading them in a way that gives them the best possible chance of reducing that risk. And then critically on the back end of that is making sure we have the support in place to support our workforce if they get exposed and if they get sick.
Right. Definitely applaud that.
God bless all of
true
you.
heroes. So definitely before we let you all go, and feel free, to stick with us if you all want to stay on for Gene and just chat with us a little more. I'm sure the people appreciate it as much as we do.
I know I will.
Yeah, but if you're just tuning in, we have the experts, y'all, as usual. IMHO Virtual Town Hall Special. We are joined by clinician Gene Cash, Police Chief Brackney, and Fire Chief Baxter. So I know one thing that I have for you guys is as far as your projections, everybody is trying to make these predictions. At one point, our president was talking about he was going to have this thing fixed by Easter. Lord have mercy. And then going forward, there's so much collateral, right? That's going to be built up to where even once we have a medication or whatnot, there's just so much to follow that to where it's going to be a different world we live in. So I'm sure we all would love to know, when you hear these projections on how bad things could get over the next week, like what are some of the plans you guys have, and then just for the future, for your vision of the city?
So,
Chief?
I was going to say thanks to the other Chief B. So a couple things that I would just rather comment on rather quickly. Although we don't have any statistics as to why at this point in time, and doing the background as to why African Americans are dying at a higher rate and at a faster rate, I think part of it would be to some of the misinformation that has gone out very early about how it was not affecting the Black community, right? Mm-hmm. How at the highest levels, the administration have said that this was not a serious issue. It was like the flu. Mm-hmm. So I think when we talk about, as I say currently now, balancing our public health with our public safety, our community health with our community safety, I think what worries me is that where we're getting our information is going to influence how we respond. And it is the responsibility of Black journalists, Black media,
that's right.
The type of town halls that you're doing now to get that information out, to say how that we can be protected. And we're already vulnerable because there are often a lack of adequate healthcare systems in Black communities and in vulnerable communities. So the likelihood that this impacts us and continues to impact us at a higher rate really worries and frightens me. Add on top of that we still, one of the highest volumes of calls we are getting right now are shots fired in our communities and shooting at each other in our communities. So you add stress on to this through isolation, anger, and I'm sure, Mr. Cash, you're just going to hit this hard and hit this home about what are those additional mental stressors that are occurring that could really do long-term damage to our communities. So when I look at the projection models, the thing that frightens me more than anything, and I'm sure Chief Baxter can speak to this, is are we getting out the good and right information to those populations, the unsheltered populations, the elderly populations, but Black community, those persons in dense areas, possibly in public housing communities, and how do we make sure that we get the right resources so that they can protect themselves and that they can recover from this and this not be another thing, as I think about this, not getting the right information and only caring about the data points and not putting out that information can really be detrimental to our communities, and particularly Charlottesville, which has struggled with its equities and inequities around race and health and disparities in almost every other institutional system that we have in place here.
That's right. Wow, thank you. And Chief Baxter, did you have a follow-up?
Sure. Yeah, we just to echo what Chief Brackney said, we know and have known for a long time that African Americans in the United States suffer from high rates of heart disease, hypertension, blood pressure, diabetes, and so that puts African Americans on day one of this at higher risk of complications if they get COVID-19. So, and all these long-term structural inequities, these social determinants of health, housing, and access to employment, access to healthy food, access to primary care in a meaningful way, transportation, all of those things come together and are really revealed in a pretty stark way during a pandemic. And my hope is that coming out of this, one of the things that we will see is more people understanding the consequences of those social inequities long term, and taking some steps to fix those structural problems that lead to these differences in outcomes that just shouldn't be. So in the meantime, though, I think I would agree 100% with Chief Brackney that we've got to get the right information to the right people in a format that they will listen to and that they will believe. So it's going to take, it's a community-wide effort to make sure that messaging gets out there and is heard. And ultimately, it comes down to one-on-one conversations. I mean, I had one with my 85-year-old grandmother now 3 weeks ago. She kept going to Brown's because they pump gas for her because she don't want to get out of the car on Avon Street. And Mr. and Mrs. Brown are wonderful to me.
That's right.
But I finally said to her, stay home. I will bring you your newspaper. You don't need gas because you're staying home, right?
Each one teach one.
That's right. That's when your grandparents tell you, I've been on this earth longer than you have.
Yeah.
That's right. The Browns, right?
Yeah. So thank you all tremendously. And like I said, stay online as long as you can. But we're going to sort of shift the conversation more toward.
Can I just
Dr. Cash, go ahead.
I just want to run one quick thing by Chief Baxter. Have you guys considered releasing the number of people that survived COVID when we talk about stressors and things like that? I mean, we find out pretty much, the health department gives us on a daily basis the people that contracted, but I'm just wondering if it would help to give them the other side of those statistics.
Yeah, that's something we've noted that as well, and I think probably the easiest metric to release at some point, and we'd have to have a conversation with UVA Health System and Martha Jefferson as the two inpatient facilities in our region to publish the information about the number of people that were admitted, diagnosed with COVID, and then were discharged.
Okay.
But I agree that's an important thing to understand. Related to that, most people who get COVID don't have to go to the hospital. About 20%, 15%, depending on where you are in the country, are being
Very
hospitalized,
true.
and a smaller percentage end up in an ICU, and a smaller percentage end up on a ventilator. But if that happens all at once in one community, that's really where we're seeing those hot spots. New York, some areas of Florida, Washington State.
Gotcha. Okay. Thank you for that.
Absolutely.
Gene Cash.
Yes, sir.
Oh, you here? Okay, you got your Xbox working now, sir.
I think I got it working. All plugged in now.
Awesome.
So,
Chief, you want to take a break?
Yeah. Let's go ahead and take a break. And like I said, you guys hang online as much as you can. But listeners, tell a friend. And y'all hit us up online, IMHO Talk Show, or here at the station, 434-422-9101. You have Charles, Max, Razor, Aaron for this IMHO Cville tomorrow virtual town hall special on our city's response to COVID-19. So stay tuned. A little more show.
And thank you to our guests.
Thank you very much. Appreciate your time and all the great work you do.
Thanks for having us.
You are real life heroes.